So my name's Shane George. I'm one of the doctors here at Gold Coast University Hospital, and I spend my time working half-time in the Children's Intensive Care Unit and half-time in the Emergency Department. We're very much a tertiary paediatric service now. We've got multiple paediatric surgeons. We have lots of other paediatric subspecialties that we didn't have before. The biggest burdens of disease in children are infection and inflammation and sepsis would be the bulk of our workload. We see quite a lot of trauma in children, and that is a demanding area. And then I think looking towards the mental health aspects of, and particularly in adolescence, so eating disorders, anxiety, depression, are probably the key demands that we see. And that's fairly similar to across the country. Probably our biggest pressure point at the moment is space. We're usually pretty full, so the demand for inpatient children's bed spaces has been pretty high, particularly over the last year or so. One of the innovative things that's happened over the last 12 months is the development of our adolescent and young adult service, which kind of expands the idea of children into that adolescent phase where they're not quite children, but they're not quite adults, in that 14 to 20-year-old phase where they have some fairly unique problems, and there's a gap in the health service for those kids. So a lot of that adolescent and young adult service is around mental health and lots of other disorders as well, but there's a significant burden of adolescent and mental health issues. One of the biggest advantages of a development like Lumina are people thinking about what's required rather than just building it and hoping it works. And if you have a facility that looks to attract very clever people, they're going to want to be able to be partnered with both the hospital and the university, and that's going to benefit everyone. If you have a clinician who is interested in doing a particular field of research and they can see they can both work clinically and undertake their research in a purpose-built development, that's going to be very attractive. And that not only benefits Lumina as a project, but it benefits the hospital and it benefits the university, and in the end, that's good for the patients of Gold Coast Health. So the more clever people we can attract, the better service we provide.